Well, did you know that there are 5 trauma centers right here in the Valley? And that's more than most metropolitan cities have in the country.
Yeah, and what does that mean to you? Well, it could mean the difference between life and death. This week, we are going behind the scenes of 3 Valley trauma centers, and we begin today with Good Samaritan Hospital, and that's where we find our Dr. John Shufeldt. Hi, how are you?
Hey, Marty. Hey, Scott. How are you?
Terrific.
Great.
Hey, when we've been promoting the 3 trauma centers here this week, and when we were at Good Samaritan Hospital, they saw patients ranging from gunshots to stabbings to even broken necks. And we have some tape for you that we're going to roll.
The trauma room at Good Samaritan Hospital is quiet for now, but that all changes in the blink of an eye. Within minutes, firefighters wheel in a shooting victim. The trauma team rushes into action and immediately takes over the duties of performing CPR. They also evaluate the patient to determine any other injuries. Without stopping, the doctor orders x-rays, and the trauma team continues to administer medications that the paramedics have started on the scene. The patient's best chance of survival is by treatment with a trauma team in a level 1 facility. Despite their best efforts, there is really nothing more they could do.
We're done. Call it.
While the severity of some cases is painfully evident, others can be misleading. Firefighters wheel in a woman who was involved in a car accident.
Restrained, airbag deployed. Chief complaints are neck and upper right chest pain.
After examining the patient, the doctor begins by ordering x-rays. The results indicate a problem with the woman's C3 vertebrae, a very dangerous and potentially deadly fracture of the neck. The doctor then orders a CAT scan of the neck and abdomen for more detailed analysis. The CAT scan does in fact show that the C3 vertebrae is fractured. However, her abdomen looks to be okay. She's admitted to the hospital where a neurosurgeon will determine further treatment, and then it's on to the next patient.
Now, when we come back, we're going to meet members of the trauma team and take a look around this trauma room and see what goes on here behind the scenes.
Yeah, and I know in a lot of cases people would decide to have their babies at Good Sam because it is a trauma center and things of that nature. I mean, it's a big deal.
It is a big deal. It's a tertiary care center, and they treat patients with all levels of traumatic injuries here and also all levels of medical conditions.
Yeah, I've heard people say if you're going to have a life-threatening emergency, Good Sam is one of the places that you want to be.
That's very true.
That's excellent that they gave you full access to all that.
It's amazing.
Yeah.
Right,
Little do they know.
Yeah. Back, everybody.
Time now to head down to Good Samaritan Hospital. That's where Dr. John Shufeldt is, and we are going behind the scenes of a trauma center. Hi.
Seems pretty quiet there right now.
We're over here right now at Good Samaritan Hospital, one of the 5 trauma centers in Maricopa County. We're here with Dr. Andrew Smith. Andrew Smith, welcome.
Thank you very much.
I was going to ask you, what's it actually take to be a trauma surgeon?
Well, all the trauma surgeons here at Good Sam are board-certified general surgeons. They went through 5 years of general surgical training, shown an interest in trauma, had trauma training, and then went through the board certification process. Each individual institution sets some of their own standards. The state sets some of theirs as well.
Now, how often are you on trauma call here?
It ranges from 3 to 5 times a month, depending on the month and how the call schedule works out.
Well, and then how many patients a day would you say? That's a 24-hour call, I take it.
Correct. We come in at 7 a.m. and we leave at 7 a.m. the next day. That's one of the requirements of being a trauma surgeon. And we see a range anywhere from, you can have a no-hitter all the way up to as many as in the high 20s, depending on how busy the night is.
Wow, so you can easily see 60 to 80 patients the month that you're on trauma.
Absolutely, you could. Normally, it's probably in the range of 40 to 50 at the most.
Wow, and then you follow them in the hospital as well with the trauma team?
That's correct. Most of our blunt injury patients tend to go home within the next 24 to 48 hours, so there's not a lot of burden on the staff as far as that goes. But the sicker patients that require surgery do tend to stay longer.
Okay, great, thanks.
My pleasure.
Let me talk to Robinelle. Robinelle, you are the trauma coordinator here.
Yes, I
Now,
am.
what does that mean?
Actually, what I'm responsible for is making sure that the staff here, the trauma nurse, the physician, have the supplies that they need, that the processes are in place to be able to take care of those critically injured patients.
Now, there's 5 trauma centers here in the Valley. What does it actually take to be a trauma center? Because that is not a small deal.
It's a hospital that has designated the resources and medical staff to be able to care for a severely injured or potentially severely injured patient. And we are unique in Arizona in that there's no other city, let alone state, that has as many trauma centers in such a close area. And yet we are all very, very busy, and has to do with population and just the uniqueness of Arizona.
Wow, so the hospital also has to go through certain, is it state designations, national designations?
It's a self-designation process in Arizona, and we go through the ACS guidelines. There's one facility that is ACS verified in Arizona, and what you do is you put into place the processes. You have to have access to an OR suite 24 hours a day. The special equipment, you have to have specially trained nurses. We are a teaching facility, so we have a resident program. So we have residents that respond to the traumas in addition to our trauma surgeons. And then we have a trauma clinic where our patients actually can come back after they're discharged, and our trauma residents see them even after. So we see those patients in a whole, whole continuum.
Very
of trauma,
good.
yeah.
Let me talk to Rakia over here. Rakia, now you're already kind of a TV star, I understand, rescuing people out of a dump truck. Talk about the trauma team. How does the trauma team work here?
Well, we have an excellent team of trauma staff, from our trauma physicians and our core trauma nurses that are specially trained for trauma. And then we have excellent ancillary staff, from radiology to respiratory therapists and lab. We all work together for the benefit of the patient to get everything done in a timely manner.
And then there's neurosurgeons on staff 24 hours a day waiting for patients, and a whole kind of continuum team approach for trauma.
Exactly.
Okay, and that's what actually what makes it a trauma center and center of excellence for that.
Teamwork is the essence here.
Very good. Now, you rescued someone out of a dump truck, I heard.
Actually, I didn't rescue him out of a dump truck. I was at the scene.
You're at the
scene. Yeah, and I actually got out of my car to go see how he was doing, and he had actually hit another car, and I went to go check on the family as well.
Now, is it when it gets busy in there, how busy actually is busy here? Is it just up for grabs?
It's up for grabs. I mean, we get pretty busy. Our census has been climbing, and our acuities have been climbing as well. So it's been pretty busy, but we like that here.
It is amazing with 5 trauma centers it stays that busy. Well, Marty and Scott, thanks. We're over here at Good Samaritan Trauma Center and just hanging out with the trauma team and having a great time. Tomorrow we will be at the Maricopa Burn Center talking to the folks over at the Burn Center.
Another group of people that do amazing work.
Yeah,
absolutely.
It really is. Thank you, John.
Thank you very much for that. Very interesting. And if you'd like any more information about any of our TopDoc segments, you can log on to the website, aztopdoc.com.
Okay, we're going to
About a series that we've been working on this whole week, and you know, from being injured in a car accident to being burned in a fire, no one really wants to think about that kind of tragedy.
Yeah, and as Valley residents, we are certainly lucky enough to have 5 trauma centers in Phoenix to treat level 1 trauma injuries.
You know, and all this week we've been looking behind the scenes at those trauma centers around the Valley, and Dr. John Shufeldt is at St. Joseph's Hospital here today to show us what they do down there. Hi, Dr.
Hey,
Shufeldt.
Doctor.
How you doing?
Good.
Hey, we're down at St. Joseph's Hospital, like you said. Now, St. Joseph's Hospital treats more trauma patients than any other hospital in the state, and we were lucky enough to be able to go behind the scenes. So kind of let's take a look at that and see what they do.
Every shift at a trauma center begins the same way, with a meeting. It is no different here at St. Joseph's Hospital. Here, trauma team nurses, who are called clinicians, discuss the patients who have made their way through the trauma room and into the hospital. When they're not working in the trauma room, these clinicians act as liaisons, coordinating the patient's care and treatment while in the hospital. Trauma teams must be ready for any type of injury in a split second. It's November 5th. A 15-year-old boy is the victim of a car or pedestrian accident. Paramedics on the scene have inserted a tube into his airway to help him breathe. He is airlifted to St. Joseph's Hospital. At the hospital, the doctor receives a report from the paramedics on the scene.
Sanchez, 15-year-old car pedestrian accident was...
At the same time, the rest of the trauma team begins to assess the patient to determine possible injuries. The team is combative, indicating the possibility of a head injury. The doctor orders multiple x-rays and a CAT scan. The results indicate the teen is suffering from a severe head injury. He's admitted to the trauma intensive care unit for further treatment by a neurosurgeon from Barrow Neurologic Institute. Since Barrow is located at St. Joseph's Hospital, some of the most severe head and spine injuries are taken there for treatment.
Hey, when we come back, we're going to meet some members of the trauma team and kind of talk about what kind of issues they're facing right now. We've all heard about the issues that Las Vegas face with lack of funding for their trauma system. We're going to talk about some of the members of the team about that issue and the medical malpractice crisis and kind of, again, what goes behind the scenes.
Terrific, Doc. Report at St. Joe's Hospital.
Hi, Dr. John.
How are you both?
We're great.
We are still back here at St. Joseph's Hospital in the trauma room with one of the trauma surgeons, Dr. Raymond Seamus, and one of the trauma nurses, Dr. Mariel Price. Dr. Seamus, welcome.
Thank you.
We were going to talk a little bit about trauma funding. I know that's kind of a big issue right now in this state and other states. So what's your perspective on that?
Well, the problem with trauma funding is, number one, we don't have enough funds. The major reasons are that we're seeing more trauma patients than we've ever seen before, as particularly in Phoenix, the population is exploding. Many of these patients are uninsured, and the tests that we are doing today are much more sophisticated and more expensive, and as a result we need better equipment and more staff. And if we combine all of those together, it equals we're losing money,
right,
because we're not collecting from uninsured people.
Right, and actually I think all the trauma centers really pretty much in total lose money. Am I correct in that?
From what I believe, yes.
Do you see the medical malpractice crisis like they had in Las Vegas an issue here as well?
I think it's developing. Our malpractice rates are definitely spiraling every year, and I'm sure with time we are going to have a crisis.
Right. It sure seems like that, and I think Las Vegas fixed their crisis, and I have a feeling we're not too far behind since we have a similar kind of economy.
Right.
Okay, over to you. Tell me you see trauma patients here day in and day out, both on the floor and in the trauma room. Give me some things that are so preventable that they end up making you mad and frustrated.
Oh my gosh. The first one is seatbelts. Whether it's adults or children, we find them to be unrestrained, and the injuries are so much more severe in an unrestrained driver, passenger, or child. This is 100% preventable.
What else? Give me some other ones.
Helmets in kids, helmets in adults, anybody who's riding a motorcycle or a bicycle, skateboards, rollerblades, anything like that, these people need to have helmets on because your head's the most important part of you that you've got. You need to protect it.
And you only have one.
You only have one. You don't have a replacement.
Now let's hit the big one. I have to say, from my experience, alcohol.
Oh, alcohol and drugs. It's amazing how many of our patients come into the trauma center that have drugs and or alcohol, or mostly alcohol, but alcohol or drugs on board, and it's a big deal.
Right.
Trauma is a surgical disease in large measure, and when we have to put people to sleep and they're compromised by drugs or alcohol, it makes it a much more serious and dangerous thing for the physicians that are caring for them.
It absolutely does. Well, Scott and Marty, we are fortunate here in Phoenix to have 5 level 1 trauma centers here, and thanks to great people like Dr. Seamus and Mariel, they are still functioning, taking great care of patients that come in here.
No doubt about it.
We are fortunate here in the Valley. A lot of very talented physicians.
Absolutely.
You top the list, Doctor. We'll see you back again real soon. In the meantime, if you want any more information about any of our Top Doc segments or any of the physicians or medical centers you see in the pieces, you can log on to aztopdoc.com for more information.
Bank on that.
Busy man today.
A little more health news for you now. In today's Top Doc segment, Dr. John Shufeldt is taking us to Barrow Neurological Institute at St. Joseph's Hospital.
That's where he's following a neurosurgical resident through a typical day. Dr. Shufeldt, how are you?
Erica and Frank, how are you doing? I'm doing fine, thanks. Happy day before Christmas.
And happy holidays to you, too.
Now, you probably didn't know this, but today marks the 1-year anniversary of our Top Doc segment. And since it's the holidays, it is. It's a 1 year. It's the 12th time we've done it. And since it's the holidays, we thought we'd do something a little bit different and surprise you. Do you ever wonder what your doctor goes through before they're examining you, before they actually become finished with their residency program? Well, in a little bit here, we'll be following a resident physician, Dr. Ruth Bristol, around, and we'll try to catch up to her. She's working at the Barrow Neurologic Institute here in Phoenix, and see what she does to become a neurosurgeon.
The day starts before 5 a.m. for Dr. Ruth Bristol, a third-year neurosurgical resident at the Barrow Neurologic Institute. Before going to the operating room, Dr. Bristol performs rounds with the rest of the team, which consists of other resident and attending physicians. These rounds happen twice a day, every day of the year, and can take up to several hours. During these rounds, the team reviews the previous day's notes. The team also examines the patient, and more notes and orders are written and added to the patient's chart. After rounding, the team attends a morning conference. There, they discuss new developments and techniques in neurosurgery. After the conference, the chief resident assigns surgical cases to each resident, and then it is off to the operating room. Today, Dr. Bristol has been assigned a laminectomy as her first surgery. A laminectomy is used to treat patients with chronic neck or back pain. It is performed when the patient is having trouble using or feeling an extremity because a nerve is compressed by a bulging disc or bony fragment that sits adjacent to the spinal cord. The surgery involves making an incision and dissecting down to the level of the vertebral body and freeing up the problem nerve. The procedure also uses hardware called pedicle screws to help stabilize and support the bones after the repair is made. In the course of a typical day, Dr. Bristol may assist in several different surgeries with different attending physicians. This constant and varied exposure to multiple patients gives the residents at Barrow Neurologic Institute training that is truly second to none. After her cases, Dr. Bristol rejoins a team of residents for an afternoon imaging case conference. Today's conference is conducted by world-famous neurosurgeon Dr. Robert Spetzler. During the conference, Dr. Spetzler reviews the CT scans and MRIs of patients who are scheduled for surgery, as well as those same tests on other patients to determine if surgery is actually needed. This conference can also last for several hours, depending upon the number of patients being treated at Barrow.